you've mentioned some examples of innovations, and we've talked about or mentioned some in that previous little, summary. But what are some examples of innovations that help create learning health systems now?
Yeah, I think that so if you visualize a learning health system as a cycle, like a improvement cycle, and it's a circle. So on one half of the circle is data input. So we're good at we can now collect data with electronic health records, with registries, with patient-reported data, increasingly now with wearables and all that. We have this now ability to create these data-rich environments around patients. But then the question is, what do you do with that data? Like, the other side of that cycle is the action side. So one is the learning side and one is the action side. And that there's this iterative process of continued data acquisition and analysis and continued systems change. So how do we collect data at high enough resolution, analyze it, report it, that it can actually provide meaningful insights to improve care? And data can be, like, as I mentioned, any of the things that we talked about. It can be in-hospital data. It could be process data. It could be outcomes data. It could be patient-reported data. It could be healthcare provider-reported data. It could be data on cost. It could even be data on planetary impact of healthcare. So all of these data streams coming in. The problem, I think, where health systems are, we're not quite good at integrating that data into meaningful action. And so that's where we are now. And the question you asked is, do we have good examples of how this sort of new learning health systems approach actually improves care? We've started to do this at our hospital, Vancouver General Hospital, where we've created dashboards for all of our services. And now our services can respond to their dashboards. And we've seen in some of our units, like our liver transplant unit, we've actually seen improvements in patient outcomes because they're starting to measure and respond and target sort of micro interventions to try to optimize their dashboards. So we're beginning to see where it's beginning to happen, but we're still early days.
That's super cool. I mean, part of it is being able to figure out how you can collect all that data. But I think the second half of it is being able to suss out which data points are relevant to gather, because there's so much information to gather, but not all of it may truly be directly relevant to outcomes at hand.